An ankle sprain is usually caused by accidentally twisting or turning your ankle in an awkward way. Most of the time, the injury will resolve within a few weeks with the correct management and exercises. The ankle is a complex joint with the ability to hinge up and down, turn in and out, and rotate. The ankle gains its stability from the structural arrangement of the bones and from the ligaments that connect the bones together. A sprain occurs because one or more of these ligaments are overstretched and, in severe cases, torn. It's usually caused by a traumatic incident, such as a sudden change of direction while playing sport or a slip off the edge of a curb. Following an ankle sprain, it's very common to experience swelling and bruising. The bruising may track down your foot, so don't be alarmed if the injury appears to have affected more than just your ankle. Follow the acronym RICE. Rest, ice, compression, elevation. These techniques are particularly important in the first 48 to 72 hours. Avoid walking on your ankle too much in the first day or two. You may find using elbow crutches help in this initial phase. Inflammation is a normal response to injury. Place some ice wrapped in a damp towel over the swollen area for no longer than 20 minutes. It's important to check your ankle regularly, as ice can burn the skin. A simple tubey grip or ankle support can help to reduce the swelling in this initial phase. It will also give the joint stability while the ligaments are weakened. Please note, the support is not advisable to use long-term. Continual use of an ankle support will prevent the body's own stability mechanisms recovering. Resting with the foot above hip height is a good technique to help manage the symptoms of swelling. While medication is not usually needed longer term, you may find the use of oral non-steroidal anti-inflammatories or painkillers help to manage your symptoms in the first week. Following the first few days, it becomes important to stretch your ankle to prevent any long-term stiffness. The gradual addition of strength and balance exercises will help to regain stability around your joint. This will reduce the likelihood that subsequent injuries will occur. Your clinician will guide you through these specific exercises to ensure your rehabilitation is done at a steady rate with your recovery.
Place a band around the end of each foot. Cross the affected leg over the other leg, then pull against the resistance of the band to turn the foot away. The unaffected foot acts as a stabilizer and allows you to create more tension in the band. Return to the starting position. Place a resistance band around the ends of each foot. Make sure your feet are spread apart, so there is tension on the band. Use the unaffected foot as an anchor as you turn the affected foot outwards, away from the body. Control the return back to the starting position. Hold on to a solid object with your legs hips width apart. Keeping your knees straight, rise up onto your toes, and control the movement as you lower back down. Start up on your toes with your heels raised off the floor. Walk forward with a natural arm swing, keeping your heels off the floor. Stand on your symptomatic leg. Maintaining your balance, rise up onto your toes so the heel comes off the floor, keeping your knee straight. Control the movement back to the start position, and repeat. Step on the center of the balance pad. Bend the good leg so you are balancing only on the affected leg. Close your eyes and try to maintain this position for as long as you can. Stand on your affected leg and practice hopping, springing high off the floor and landing as gently as you can. The balls of your feet should be the first to land on the floor, followed by your heel, then a bend of the knee.